Welcome to today's talk. It's Thursday, the 29th of April. We're going to be looking at India, the United States and the UK, and maybe a little bit on Turkey today. Let's start off with the UK, where the news is really quite remarkably good. So cases in the 24 hours, 2,445. That's 15,811 in the past 7 days. Okay, that totals 4.4 million officially diagnosed. But the point is, this 15,811 is 8.6% down on the week, which is a good reduction. And in fact, it's the lowest weekly figure since the 2nd of September. And on the COVID symptom tracker app, the data is even better than that. Let's have a quick look at that. So that's the prevalence, 17,125. That's the number of new cases in the day with a regional variation, 945 new cases in the day. And here we have the graph of the prevalence going back to when this started. Now, it did actually start a bit earlier than this, but that was the figure on the 12th of June. And here is the figure now, which is it's one more, I think, 17,125. And it's the lowest figure that there has ever been on the COVID symptom tracker data. You know, I'm getting a physical sense of relief actually just looking at that. When we think about how things could have gone, and unfortunately India is an illustration of that. So COVID symptom tracker study, lowest rates of infection since May 2020, great news. Professor Spector says we're moving from pandemic to endemic, so this virus is going to be with us for some time yet, certainly for some seasons. It's going to be here, it's not going away for some time. But he's saying it's not really quite a pandemic anymore, it's more endemic with us all the time, for the next few seasons at least. Lower levels with occasional outbreaks is what we can expect now. Deaths are down, strain on the NHS is down, despite the relaxation, so we can expect the roadmap to carry on. The next relaxation will be the 17th of May, when household mixing will be allowed. So the roadmap should continue. So this is really quite good news from the UK. Now, Professor Spector has been jiggling his COVID symptom tracker data and produces all sorts of interesting things. So chances of getting infection in the next 24 hours. If you're not vaccinated in the UK, based on the current prevalence, you've got one chance in 45,000 of getting the infection. But if you've had one vaccine, it goes down to 1 in 100,000, and 2 vaccines, it goes down to 1 in 150,000, so we can see that dropping off nicely. Now, he does stress that the vaccines don't give 100% protection. And this is important to know. We know about this anyway. We've looked at this over the past few days. But the COVID symptom tracker data puts the data in quite a nice way. About 1 million reports, 31 people tested positive after the second vaccine, 87 after the first vaccine. So pretty small numbers actually testing positive, but possible. But they get mild symptoms, still at risk of mild disease is what Professor Spector is saying. So we need to still test if in doubt. So for people that have had 1 or 2 vaccines, if they become symptomatic, then they should still test. Because even although we know vaccines reduce transmission overall, what is not quite clear is if someone who is vaccinated becomes symptomatic, if they can still spread the disease. The answer is probably yes. But of course, the chances of getting it are way, way less. And the chances of getting hospitalised, getting sick or dying are even more reduced. Good news. And the news we have from India at the moment is encouraging that the vaccine, the Oxford AstraZeneca vaccine that most people are using in India, does seem to be protecting against the new India variant. This so-called double mutation or triple mutation is another one. It does seem to be keeping people out of hospital and stopping people getting very sick. So it's looking like the vaccine is protecting, if not against getting infected with the new variant, but it's stopping people getting sick, and that's the key thing. So this is encouraging. Deaths, 22, this is the UK, back to the official data now. 22 deaths in the last 24 hours, 157 in the past 7 days. It's still bad, but it's nothing like it has been. That takes us up to 127,502. That's actually up 0.6% on the week, but these numbers are quite low. Deaths on the death certificate, 151,243. So, always worth taking some time to reflect on the lives that have been lost. It's been significant. UK vaccine programme, primer dose, first dose 34 million, booster dose 14 million, total doses 48 million. This is going well. Now moving on to India, where things aren't going so well. I'm afraid India is currently breaking a few world records for all the wrong reasons. Highest daily dose anywhere in increasing cases, 379,000 new cases in India just in the 24-hour period. And when we look at the graphic for India, 300,000 line here, consistently over it, and it does still seem to be going up, unfortunately. Now, I don't normally show video clips, but it's just so upsetting that people are sick outside hospitals. This is just awful. Let's just have a look at a clip. There's no sound on this, but I'll just tell you what's going on with it. So patients sick who can't get into hospital. These, especially for someone who's spent their life in healthcare, these are just distressing scenes. See how fast that woman is breathing. That's called tachypnea. People waiting to get into hospital. Now, I wouldn't normally show pictures of individuals like this, but these are from mainstream media, so they're in public access anyway. So people sick outside hospitals, unable to access or having long delays for medical care. And this chap's clearly in distress but can't get into hospital. People frantically running around looking for oxygen, running around looking for hospital beds. This chap was saying he's been looking for about 24 hours for a place for his brother. So oxygen arriving in bits and bobs, and inside really quite chaotic scenes with sometimes critically ill patients. Now, the percentage of people who get infected as opposed to those who get hospitalised, we normally expect it to be 4 or 5%, but it does seem to be higher in India. This is people waiting for oxygen outside an oxygen factory, taking it away as soon as it's ready. Infrastructure is improved. Now, this is the Kumbh Mela, the Hindu festival that was allowed to go ahead, and I think the pictures speak for themselves. But it doesn't show the crowding in the hotel rooms, but this does clearly show the crowding in the in hospitals as oh, there you go. Terrible scenes in India, really. Really quite upsetting scenes, and we see here that the cases are going up, but that's what it means, and it's looking like a fair percentage of people that get the infection are requiring more extensive care. Deaths in India, of course, are climbing even more now. So well over the that was the 2,800 mark, but for 2 days now it's been over the 3,000, and that's the increase in deaths in the last 24 hours. So again, we see that increasing, and the distressing thing is it's hard to see why this isn't going to carry on increasing for the next few weeks. It's really hard to see why it isn't. So international aid is being sent to India, but of course it takes time, and India is a huge country. There's need everywhere. And talking to friends in India day before, what they were saying is that at the moment, John, they said, you've got to realise this is mostly in the cities. What we're really worried about is this getting into the villages, because the healthcare provision in the villages is even patchier, more difficult than in the cities. So I just don't see things plateauing in India for some time, and I don't really see I can say much more than that, really. Right. Turkey, also increasing cases in Turkey, although it does seem to be going down a bit in Turkey now, but they are calling a full lockdown. Now, this is caused by the UK variant. Turkey's got a population of 82 million people. 22 million vaccinated, or that's with 1 or 2 doses, so it's quite a long way to go yet. So quite a lot of those have not had the second dose, and there's 82 million people to get around. So these countries with large populations, of course there's nothing like as big as India, but still quite large, it's going to take some time. They're using the Sinovac and some Pfizer. Sputnik's coming as well. So they eased things in March, and that's what caused the increase in cases. So there's March there. There was easing of restrictions and cases shot up. They just released the restrictions too early before the vaccines had got a hold and started to have effect. Now the ruling party, the AK party, has had huge election rallies in March that were packed indoors. Now, as far as I know, meetings for other parties weren't allowed, but the governing party allowed itself. And this has caused super spreader events, we believe. Early April, there were some restrictions, but from today, 7 p.m. Till 7, well, that's already, isn't it? Till 17th of May, basically a fairly full lockdown. Schools closed, alcohol sales banned, and of course this goes over Ramadan and Eid. So big cultural significance for the devout Muslims in Turkey, of which there are many. Anyway, that's Turkey. Now, United States, quite interesting things actually. So the cases are still relatively high, and the deaths are still relatively high in the States. These aren't going away. Are we still in the pandemic, or would Professor Spector describe this as an endemic? I don't know yet. Still looks pandemic to me at the moment. Vaccines are going well. 43%'s had one dose. Now, the 43% in the United States, that 43% is 43% of the entire population, whereas the percentages in the UK are given as those over 18. So are actually a very high proportion of over 18s vaccinated in the States. Don't know what it is, but it'd be well over 50%. Fully vaccinated, 29.5%. And that leads us on to some pretty interesting stuff, actually, that's just come out in the past couple of days. Guidelines for fully vaccinated people in the United States. Now, that's the link. Interim public health recommendations for fully vaccinated people in the States. You can read all the detail there, but I'll give you some of the headlines on it, because it shows the way things are going to be in the next few months. I believe probably everywhere, but the United States are going ahead saying people that are vaccinated or fully vaccinated can enjoy a lot of reduced restrictions, whereas in the UK we're not saying that yet. So the United States ahead in this liberalisation policy compared to the UK. And let's have a look. Let's have a look at some of the things they're saying. So fully vaccinated, in other words, people with 2 vaccines, can visit with other fully vaccinated people indoors without wearing masks or physical distancing. Makes sense, but it's these guidelines don't apply to the UK yet. Can visit with unvaccinated people, including children, for a single household who are at low risk for severe COVID-19. So even in an unvaccinated household, the doubly vaccinated person can still go, providing there's no high risks. But this is really quite profound. I mean, this means you can have a dinner party. It means you can have friends around for drinks. You can pop round to your mates for cups of tea. It really is quite a big change for people that have had 2 doses of the vaccine. Visit with other fully vaccinated people. Participate in outdoor activities, recreational activities without a mask. Resume domestic travel, and you can do domestic travel without testing before or after travel, or self-quarantine after travel. So travel around, no testing, no quarantine. Resume international travel. No self-quarantining after you arrive back in the United States if someone are fully vaccinated. Now, this presumably even applies to places that have got high levels of disease at the moment, like India. Now, is this a step too far for now? Probably. But I'm reporting what the CDC are saying. Refrain from testing following a known exposure if you're asymptomatic. So even if you know you've been with someone who's infected, if you're asymptomatic, you don't need to be tested, apart from some specific settings, perhaps for institutions, for example. And refrain from quarantine or testing a known so in other words, if you've been in contact with someone who is symptomatic, if refrain from quarantine following a known exposure. So if you have been exposed to someone who's symptomatic or asymptomatic who has the infection, but you remain asymptomatic if you've had 2 vaccines, then you don't need to self-isolate, is what that is saying. So these are quite significant changes. Things to continue. Continue to wear a mask. Visiting indoors with unvaccinated people or increased risk. That makes sense. Visiting indoors with unvaccinated people from multiple households. Visiting indoors. So so multiple households, whether they've been vaccinated or not, you should still wear a mask. And of course, indoors we want good ventilation, as we've talked about many times. Avoid indoor large size in-person gatherings. Get tested if symptomatic. So really, quite profound changes, and there's a really good graphic that they've put on. This is directly from the CDC site here. So I'll let you look at that yourself, but it gives you all of these things that you can do. And fully vaccinated, it's green. Unvaccinated people, they're green, that's yellow, that's red. Visit a barber or a hair salon, so less safe if you're unvaccinated. If you've had 2 vaccines, you've got a green light on that one. And basically everything with here has got a green light on. So even things like participating in an indoor high intensity exercise class, I mean, wow, they're saying you can do that if you've had 2 vaccines. So that's what the CDC is saying. Rather nice graphic there, and represents really quite major liberalisations, it has to be said. So that's the way ahead for the United States, and presumably in time for other countries as well. And I think it's obvious this means you're going to have some way of demonstrating or proving that you've been vaccinated, some sort of pass or certification. That goes without saying, really. That's going to have to happen. Now, the European Union has also been commenting on people from the States. Ursula von der Leyen, vaccinated US tourists should be able to travel to the European Union this summer. Good news. The Americans, as far as I can see, use European Medicines Agency approved vaccines, so she's accepting those. Enable free movement and travel to the European Union. So this is basically saying that doubly vaccinated people from the States can travel to the European Union. Restrictions to be lifted depending on the epidemiological situation in the States, so they're going to keep an eye on it. Now, European Internal Market Commissioner, this is about vaccines now in Europe. Europe has produced enough doses of vaccine to achieve herd immunity by mid-July. Not produced, procured. Interesting. Optimistic, I would say, but interesting. New deal with Pfizer for 1.8 billion doses, now into 2023. Seem to be putting a lot of eggs in the Pfizer basket to me. But that's what they're saying. They've ordered a lot of Pfizer vaccines for the next few years. Interesting, looks like they're going to need updates till 2023 on vaccination. 50 million extra Pfizer doses from the second quarter of this year, so that's encouraging. April, May, June, that's going to be 250 million Pfizer doses now altogether. So as we say, a lot of eggs in the Pfizer basket, but another 250 million vaccines that aren't Pfizer still being used as well. So slightly concerned they're putting a lot of eggs in the Pfizer basket there, because as we said, what we're probably going to be doing is vaccinating. As we vaccinate more and more vaccines become available, rather, different types of vaccine, we'll know which vaccine works best for which group, but also we'll know which vaccine to give to minimise the side effects for a particular group. So it may well be that in a month's time, the European Union will decide not to give the Pfizer vaccine to young men, meaning that you'll want to vaccinate young men with the AstraZeneca vaccine. Let's just hope they've got enough supplies in. It looks like they probably will have. But I think that's the thing that we're going to need to take into account. Vaccinating particular groups to minimise particular side effects. I think that's all I had to say today, so that's fine because my voice is running out anyway. Must have been talking too much. let's just take a minute to pause really, and just think about the people that are suffering greatly in parts of the world, particularly in India. And unfortunately, it is going to carry on getting worse for a period of time. Okay, on that note, which is the reality of the situation as I understand it, these people sick outside hospitals in India, if we hadn't had lockdown measures in other countries, that could have happened in the UK, it could have happened in the States. There were extreme pressures in particular sectors of the health service, such as intensive care. But the strategies that Western governments have taken, I believe, has prevented that sort of situation from arising, where people were basically sick and unable to get into hospital. So plenty of questions to be asked about the way this pandemic has been managed. There's been massive mismanagement, of course, at many levels, as we've looked at. But we also see the effect of that combination of factors, including mismanagement, in the India situation. Also concerning that quite a few popular news outlets are saying that there's restrictions on news availability in India, as the government does seem to be intervening there, which is also a potential problem, because people need to know what's going on. That's why we do these broadcasts, so that you can make informed decisions. And anyway, that's anyway. Thank you for watching.